Hi everybody, welcome back to Fibromyalgia Real Talk. This is Helen Thompson, and today we are talking about a subject I have been waiting for, fibromyalgia medications. I don't want this to come off the wrong way. I am not trying to take your hope away from you or say that you shouldn't try these medications, because everybody's body is different and everybody reacts differently to the medications. All my goal is today is to give you the facts about these medications so that you can make the decision that you need to make for you. And I've had fibromyalgia, and those of us that have had it for 20 plus years probably have the same opinions about these medications, that they are all pretty much garbage and do not work for our illness. But like I said, they do work for some people. They do give people some relief, but you have to decide for yourself if the side effects and the things that it's doing to your body is worth it, okay? And hopefully I'm going to give you enough information today for that, for you to be able to make that decision. And that is my goal with this, is all. And just a couple things about medications, you guys, because I know everybody is so desperate for some relief of this pain and this fatigue and this, all of the stuff that we go through. I get that. I understand that. I'm with you. I'm looking for that quick fix too, but there just isn't one. And medications were never made to cure or treat an underlying cause of an illness. Medications are only created and made to treat symptoms. So you need to remember that. This is why you're not going to find one pill that's going to fix everything for you ever, because that's not how they're made. So just keep that in mind as well. And then just a couple other things I want to point out is a lot of these medications are in the seizure category, meaning that they were created to help seizures and like spinal cord type injuries. The reason those don't work for us is because of the way they work. So when you have a seizure, your electricity in your head is just firing off on both sides of your brain, just sporadically, and so you lose that connection between your brain and your body, and so your body doesn't know what to do, and so because that's happening, your body just stops functioning, and then you just have the shaking because there's no communication between your body and your brain. The problem with them giving us those type of medications for fibromyalgia is that we do not have sporadic firing of our nervous system. So when you take these drugs, that's what they're looking for. They are looking for, where's that irritable spot that's firing off, and let me go in there and stop it. The problem is with fibromyalgia, we have an overactive nervous system, but it's functioning within the regular nervous system. It's not firing outside the nervous system in sporadic ways. And so the drug can't find the area that it's supposed to be going to fix. And this is why we have so many problems with these drugs. You have to understand how they were made to work, because they don't know the exact trigger for fibromyalgia, or where in the brain it is, or if it's more than one area that's malfunctioning. How can they possibly give us a medication that is going to work for us? I mean, that is just ridiculous in all logic. If you have a logical brain and you think about this, that doesn't make any sense at all. So basically, the reason I'm saying these things is because well, let me tell you one more thing first. The other set of drugs that they give us are antidepressants. The reason they give us these antidepressants is because the neurotransmitters in our brain are low compared to other people. And when your serotonin and your dopamine and your norepinephrine and all those kind of neurotransmitters are not you don't have enough functioning in your body, then you're going to have feelings of depression, you can have pain, you can have suicidal thoughts, you can have other mental illnesses and issues with low neurotransmitters as well. So at the end of this video, after we talk about the medications, I'm going to tell you which neurotransmitters are off in our body and tell you how you can get tested for those so you know for sure. Because maybe that way you can find a medication that's going to work better for you. But their thought is, with these neurotransmitter medications or depression medications, they call them mood stabilizers, is that if they get our neurotransmitter levels back up to where they should be, that our pain is going to disappear. And that is just not going to happen. It's going to help with our depression because we all have depression from dealing with chronic illness. It's just going to sneak up on you at some point. If you've never had depression before and you have this chronic pain illness, trust me, you're going to have some depression. So they do help as far as that goes, but they're not specifically going to help with the fibromyalgia. And you know, this is why I'm saying medications treat symptoms, they don't treat the root cause. So let's just get right into it, okay? First one I'm going to talk about is pregabalin or Lyrica. It was made for epileptic seizures and control of spinal cord injury pain. It was approved for fibromyalgia in 2007 without any clinical trials at all. So basically, they were just saying, oh, well, we give this medication for neuro problems. Let's give it to the fibromyalgia people. Okay, so I already told you the problem with that. It can be toxic in your body. It metabolizes in the kidneys. Everything pretty much that you take metabolizes through your liver or your kidneys or both. So just keep that in mind too, because if you have kidney disease or fatty liver or other liver problems, these medications are really not good for you and they can harm you worse. Okay, so you need to know what you're taking and how it's working in the body. So in the clinical trials for Lyrica, not for fibromyalgia, but initially for what they use it for seizures, every medication has a maximum dose. The maximum dose, basically what that says is when they do clinical trials, they start with the very lowest dose that they actually start seeing results with, and that's usually the dose that you start with. And the max dose is the highest dose that they can give the rats or whatever they're testing, where it stops becoming effective any longer. After that. So that's how they get the max dose. So just keep that in mind. So the max dose of effectiveness for Lyrica is 300 milligrams in 24 hours. So you can take 100 milligrams 3 times a day in 24 hours. That is the maximum dose. So what happens when you take over the maximum dose? Because sometimes these doctors like to give us more because they think more is better. More is not better with medications. It just adds more toxicity and issues, side effects to your body. So what happens is when you take more than the maximum dose, it can cause side effects to be worse. It can cause the dangerous side effects to be more prominent and just kind of show up out of the blue. It's really going to cause your fibromyalgia symptoms to be worse because it's no longer effective after that dose. Okay. So some of the life-threatening issues that you will get with Lyrica, if you have any kind of peripheral edema, which when I say peripheral, I mean hands or feet. So if you're getting hands, ankles, feet edema, or swelling of your face, throat area, that can be very dangerous. If you have suicidal thoughts, if you have serious breathing problems where you're wheezing and it's hard for you to breathe. Now, this one's really important because a lot of you post on these sites that you have rashes with blisters, okay? That is not a fibro thing. Fibro creates rashes kind of here and there in your body, but it's just a contact dermatitis. It'll just be red, it might be itchy, it might be, you know, a little irritating or whatever, but fibro does not produce hives and it does not produce blisters. So if you have a rash with blisters, so hives, rashes with bumps, and blisters is life-threatening with Lyrica. So if you're on Lyrica and you started having these kind of rashes with blisters, you need to talk to your doctor and get off that medication. It also causes dizziness and somnolence. So other side effects that are a little bit less serious with this, it can worsen your depression or anxiety. It can give you panic attacks. You can have trouble sleeping. It can cause vascular tumors. This is not good. It causes weight gain, obviously, dizziness, blurred vision. It causes low platelet counts, which is called, it can cause a severe thrombocytopenia. So what that is when your red blood cell counts and your platelet counts are really low. And the problem with that is that when your platelet counts are low, you won't stop bleeding. So if you get a cut or you fall and bump your head and it starts bleeding inside your head, it's just like being on a diuretic. You will not stop bleeding, okay? So you will have easy bruising with this medication. A lot of you say, oh, these bruises just started showing up. Yes, with fibromyalgia, we do have occasional bruising that shows up out of the blue, but mostly it's in our peripheries. So it would be your hands or like blood vessel breaking, in your hand or in your foot, just something like that. It's not going to be all over your body. So if you're having bruising that's showing up all over your body, it could be due to your medications. So pay attention to that. Have your liver enzymes blood work done with your doctor because Lyrica may be affecting your platelet counts. If you get a pinpoint reddish or purple spots on your skin, that's called petechiae, and that's another rash that can happen with Lyrica. And that one can happen all over the body. So some of you have said you get, these little purple rash, these little spots, on your abdomen or your torso area. That could be happening from Lyrica. But we do get the little petechiae rashes with fibromyalgia, but just pay attention to when it started. It can also cause heart blocks. So if you have a heart problem, you should not be taking this medication. Finally, there's fertility issues with everything, okay? So you really need to know, especially if you're in the childbearing years, whether these medications are going to be harmful to you or your baby. So, and sometimes there's fertility issues for men too, so I'm going to give you the information that I have. So Lyrica can cause low sperm count and infertility in men. In women, it can cause birth defects and miscarriages. So if you were on Lyrica and you had miscarriages, that could be why. It also crosses through breast milk, so you can't be nursing and on this medication. When this medication is given to kids 12 to 17 years old, the studies found that it can cause deficits in learning and memory, altered motor activity, and reproductive impairment. So if you have a teenager at home or somebody in their early 20s that is taking Lyrica for this disease, you really don't want them to be on this medication. So there's not very many benefits of this medication at all for us. That's all I'm saying. All right, next, Cymbalta or duloxetine. This is an SSRI medication, and what that means, it's a serotonin reuptake inhibitor. Basically, it works on your neurotransmitters, and it's for depression and anxiety, okay? Reuptake means that the cell that makes serotonin can take the unused portion back up into the cell and recycle it so that we can continue to have serotonin in our system. So the drug Cymbalta and other SSRIs stop this action so the cell doesn't take the serotonin back up, which leaves more serotonin in your blood so that hopefully it can, help your depression or whatever is going on. The problem is that we're already low on neurotransmitters and receptors. So in order for this to be effective for us, we have to have the receptors to take all of this serotonin circulating in our blood into our cells for it to work. So you're creating a little storm here called serotonin syndrome, which y'all need to look up because if they put you on more than one depression medication, this can even be worse. But you have all the serotonin circulating in your blood and nowhere for it to go, and that can cause major life-threatening problems in your body. So that's what's going on there. The maximum dose, the smallest dose is 60 milligrams. The maximum dose is 120 milligrams in 24 hours. If life-threatening, side effects are hives, facial swelling, fever, sore throat, and burning eyes, skin pain, a purple skin rash with blistering and peeling. Well, what do you know? Cymbalta and Lyrica now both cause rashes with blisters and peeling. So if you have those issues, you need to get off these medications. Those are life-threatening. Serious side effects with this Cymbalta: pounding, fast, fluttering heartbeats. How many of you have said that you suffer from those? Yeah. So fibromyalgia itself does not cause these things. So it's, again, the medication. You're having side effects. You don't even realize you're having side effects because the doctor doesn't give you all of the side effects. They only tell you, oh, it might cause some nausea, it might cause some dizziness, blah, blah, blah. Most people do well with it. Okay, well, in our condition, because it's different and they don't know how it works in the body, we are not everybody else. So we have to be careful with what we take. So you can become lightheaded, you can pass out, easily bruising also with the Cymbalta, painful or difficult urination, impotence or sexual problems, liver problems. It can cause right upper quadrant pain, which is where your liver and your gallbladder is. And I know a lot of you have complained about, oh, I don't know if, this is gallbladder, is this my liver, what's going on here? Doctor can't figure it out, everything looks okay. It could be the Cymbalta that you're on that's causing that right upper quadrant pain. Itching, it causes dark urine and yellow eyes or skin because it affects the liver. So if you're getting jaundice and the white of your eyeballs is getting yellow, or you notice that your skin's turning a little yellow, that's close to liver failure. So you need to get off the medication and go see your doctor right away. It can cause headaches, confusion, slurred speech, severe weakness, vomiting, loss of coordination, or a feeling of unsteadiness. Okay. So here's the things that you need to go to the ER for. The serotonin syndrome can cause severe agitation. So if you're becoming really, really agitated, you need to go to the ER. Hallucinations, fever, sweating, shivering, fast heart rate, muscle stiffness or twitching, nausea, vomiting, or diarrhea. Those are the things that you need to go to the ER for if you're on Cymbalta. And then just, the regular side effects: drowsiness, nausea, hot flashes, sweating. It increases your sweating. You can have abnormal dreams. You can have electric shocks in your brain. And actually, this medication causes restless leg syndrome. So if some of you have started this medication and now all of a sudden have restless leg, you need to get off this medication. That's what's causing it. It causes seizures. It causes yawning. Which, when I say yawning, I mean uncontrollable yawning. So you're just like yawning all day long and you don't know why. It can cause high blood pressure and it can cause bleeding problems. If you're pregnant, do not breastfeed because it can cause do not breastfeed. It causes excessive bleeding during childbirth as well. So if any of you have had any of those issues being on Cymbalta before you have a child, that's serious. It could cause serious medical complications with the baby. Now, some of these medications have interactions with other medications. I'm going to tell you what Cymbalta is not safe to take with, and you guys really need to pay attention to this. When the doctors are giving you, 5, 6, 8 medications, you need to know if they are all safe to interact with each other inside your body. Okay, so Cymbalta is not safe to take with NSAIDs, which is ibuprofen, Adderall, which is a stimulant for your brain, amitriptyline, Flexeril, opiates, tramadol, trazodone, and Wellbutrin and Zoloft. Cymbalta has interactions with all of those medications. What does an interaction mean? Interaction means if you take 2 medications together, one will either turn the other one off so that it doesn't work at all, or one will accelerate the other one and make it so that you can become toxic or something in your body. So, whatever effects you're having from the medication can be worse, more side effects can start, whatever, because that medication is now boosted and stronger than it was before. That can be very dangerous. So that's what it means when there's drug interactions. And you need to take these seriously, because I'm a nurse and I work in the hospital, and I've seen what can happen if you take these medications and they have interactions with each other. It's just not good, you guys. And honestly, do you want do you want to become a zombie or have your body not function properly or have your body constantly be toxic just because you're that desperate for relief from your pain? Now, I understand, believe me, we do need relief, but we are not that desperate that we are going to be guinea pigs and hurt our own bodies just because this is the best they can do for us. I'm just not okay with that. So gabapentin, this is the one I hate the worst out of all of them. I know a lot of you swear by it. A lot of people say that it works well. I give this drug a lot in the hospital for a lot of different nerve issues. But let me tell you, everybody hates taking it. A lot of times I go in to give it to patients, they're like, oh no, I'm not taking that drug ever again. It doesn't work. It's a horrible drug. So let me tell you about gabapentin. It's an off-label drug. So when I say off-label, it means it has not ever been okayed to work for fibromyalgia. And you guys may think that using drugs for off-label things is okay, but the problem is most of the time they do that, they've done no research, no clinical trials, and they're using you as a guinea pig and say, oh, well, this used for other similar things, so let's try it on you and see if it works. Okay? So you need to be aware of that. Off-label uses of medications is dangerous. Okay? So this medication, gabapentin, is used with other medications, not even by itself usually. It has to be used with other medications to treat seizures and nerve pain. It's not approved for fibromyalgia. They don't even know how this drug works in the body. When I was looking up how it actually functions in the body, they have no clue. So you're putting a drug in your body that's doing things to your body that nobody knows. And this is why this drug is dangerous, because it causes permanent damage to your brain. And there's plenty of lawsuits out there against this drug right now. So please take it seriously. That's all I'm asking. Just take it seriously and don't, that's all I'm going to say about that. So the maximum dose, because I could talk about this all day long, a maximum dose for gabapentin is only 1,800 milligrams in 24 hours. How many of you guys are on 2,400 milligrams or higher of gabapentin? Okay, you are damaging your organs in your body and your nervous system with this drug if you're taking more than 1,800 milligrams a day. That's all. Anything above that, all it does is worsen the side effects, worsens the serious side effects, and makes your fibro symptoms worse. And when it's used for restless leg syndrome, because sometimes they give it to you for that, the max dose for restless leg syndrome is only 600 milligrams a day to treat that. So you need to keep that in mind. If you're taking more than that, more is not better with medications, you guys, I'm telling you. Okay. And one other thing I wanted to mention, if you're taking any of these medications and you keep having, they work for a couple of months and then all of a sudden they don't work anymore, so they increase your dose, same thing, increase your dose again. If you keep having to increase your dose on these medications, they are not working in your body, and you can reach the max dose and you'll still have to, that's your clue. That's what's telling you right there. If you have to keep increasing your dose. Sometimes you do have to increase it a few times to find that dose that's going to work for you, but if it continues to stop working, and then you keep having to go in and say, hey, it's not working anymore, it's not working, period. So get off of it. Try something else or just stay off of it. The life-threatening things with gabapentin are hives and rashes, edema, and difficulty breathing. Call your doctor if you get skin rashes, fever, swollen glands, muscle aches, severe weakness, unusual bruising, upper stomach pain, weak or shallow breathing, blue-colored skin, lips, fingers, or toes can be blue as well, confusion, extreme drowsiness, balance problems, involuntary eye movements, or seizures. Those are all serious. It can cause memory trouble, concentrating problems, headaches, dizziness. You should not use gabapentin if you have COPD, any other lung issues, kidney problems, diabetes type 1, depression, seizures, liver, or heart disease. So you shouldn't even be on that drug if you have any of those issues. This drug, look what this drug can cause in your body. It can cause atrial fib, which is an irregular heartbeat that's really bad. It can cause you to have strokes and things like that. It can cause congestive heart failure. It can cause you to have a heart attack. It can cause pericarditis, which is fluid buildup around your heart, which is life-threatening. It can cause tachycardia, which is a fast heart rate. It can cause dry eyes, dry mouth, incontinence, photosensitivity, psoriasis. It can cause weight gain. Get this, you guys. Gabapentin can cause Hodgkin's lymphoma and breast cancer. And I guarantee you this is probably the big spot of the lawsuits right now, is the brain damage and the cancer problems that it causes. Some of the drug interactions with this one, you can't take it with antacids, with amitriptyline, with antihistamines, with antipsychotics, with other opiates, with tramadol, with Adderall, with Lyrica, with Cymbalta, anti-anxiety medications like diazepam or Valium, lorazepam or Xanax. Okay? So you shouldn't be taking this drug if you're on any of those other medications. Next, Topamax, or topiramate is the other name for it. It's also an off-label drug. It is metabolized through your kidney. This is an anticonvulsant drug, so it's made for seizures and sometimes used for migraines. So how is that going to help fibromyalgia, right? So call your doctor if you're on this drug and you have vision problems, eye pain, sudden vision loss. That vision loss, if it's not treated immediately, can become permanent. Confusion, memory, speech or concentration issues, fever, hot, dry skin, kidney stones, or difficult urination. This drug causes too much acid buildup in your body. So signs of if your body's getting too acidic, you will have irregular heartbeats, you will feel tired, you'll have a loss of appetite, you'll have shortness of breath, you have trouble thinking, meaning you can't just focus on anything, severe weakness, and passing out. So those are all things that you really need to be seen for right away. Other side effects, it just goes on and on with these drugs. Dizziness, slow reactions, which meaning if you touch something hot, you're not going to come off of it as quick. Your reactions are going to be a little bit slower. Drowsiness, numbness or tingling in the arms and legs, changes in taste. You can have fever, you can have weight loss. You can have cold symptoms like a stuffy nose, sneezing, sore throat, mouth sores, palpitations, orthostatic, which is low blood pressure when you go from sitting to standing or bending over. Raynaud's. This drug causes Raynaud's. You can get orbital edema, which is edema around the eyes, GERD, incontinence, and liver failure. The drugs you should not take along with this one are Benadryl, Cymbalta, Flexeril, Lyrica, Metformin, Tramadol, Trazodone, Xanax, or Zoloft. Do not take this if you're pregnant. It increases the chance of low birth weights, cleft lip, and will make birth control pills less effective if you're not even pregnant. So just be aware of that. Okay, next is Savella. This is a lot of talking, so let me grab some water. All right, Savella, which actually is the only drug on this list that actually was created to help fibromyalgia people, is actually the same drug as Cymbalta. It's a serotonin norepinephrine uptake. It works through the kidneys and the livers. The maximum dose of Savella is 100 milligrams, but it says you can use up to 200 milligrams in 24 hours. Call the doctor if you have little or no urination. It causes retention in your bladder, so that can become serious and cause kidney problems. Causes blurred vision, tunnel vision, eye pain. If you're seeing halos, that's not good. If you can have seizures, lightheadedness, passing out. Again, it can cause liver problems, so look for the yellowing or the dark colored urine. Call 911 if you have severe agitation, a very fast heart rate, hallucinations, fever, sweating or shivering, muscle stiffness, twitching, or loss of coordination. It causes constipation, dry mouth, high blood pressure. Night sweating is a big one with this one. It causes insomnia and causes you to have bad nightmares and issues like that. So you cannot take Savella with NSAIDs, with sleeping pills, with muscle relaxers, with anxiety or seizure medications. All right, next is Flexeril or cyclobenzaprine. This is the one they give us. It's a muscle relaxer. It blocks nerve impulses that are sent to your brain to relieve muscle spasms. You need to call. This one works great for me. I'm on this one. I take it at night because, at night when we're sleeping, we're relaxing. Our body's coming off being really tense, and sometimes as it's trying to relax, we get those muscle spasms. And so that's why I take mine at night, because also it makes me a little drowsy, so it helps me sleep at night. I can't take it during the day or I'm just a zombie. But this one can also cause fast or irregular heartbeats, chest pain or heart attack, sudden numbness or weakness somewhere, slurred speech, and balance problems. It also causes dry mouth, nausea, can cause gastritis. Do not take Flexeril if you have a thyroid disorder, if you have heart block or heart failure, or if you've had a recent heart attack, because it can affect your heart in a negative way if you're still healing from any of that stuff. Medical interactions: do not take Flexeril if you're taking Wellbutrin, Tramadol, Verapamil, Benadryl, Parkinson's meds, or stomach acid medications. And you're going to notice something here. I don't know if you guys have noticed already, but all of these medications interact with Tramadol. And Tramadol is the big drug that they like to give us all now. So be careful, because like I said, it's dangerous to take these medications that interact with one another. So now I'm on Tramadol, or Ultram. It's an off-label medication as well. It's an opioid. It's 50 to 100 milligrams every 4 hours, or 400 milligrams in 24 hours is your max dose. You cannot take more than that. It's dangerous. Not to mention how many people have gotten hooked to this medication, how many people have died and OD'd on this medication. And then I have a feeling that some of those deaths were drug interactions. They were taking it with other medications, just like us. They give us all these medications, and then eventually it gets toxic in your body and it can kill you. So you really have to be careful. Call 911 if you're taking Tramadol and you have hives, trouble breathing, swelling of your face and throat, or a blistering rash. Look at how many things cause those blistering rashes, you guys. If you have noisy breathing, shallow breathing, slow heart rate, weak pulse, lightheadedness, seizures, or loss of appetite, you need to call your doctor right away. This drug can also cause that serotonin syndrome to happen, which is why you shouldn't take it with those other depression medications. It can cause stomach pain, dizziness, headaches, missed periods this one causes. So women, if you're taking Tramadol and now all of a sudden you're missing your periods, you need to get off this medication. Causes sweating, shivering, and itching. Do not take Tramadol with cold or allergy meds, bronchodilators, diuretics, diazepam, Xanax, Klonopin, sleeping pills, or stimulant medications. All right, next is amitriptyline or Elavil. It's an antidepressant. It actually is what we call a tricyclic antidepressant, because most of the depression medications only have two neurotransmitters that they're helping for the reuptake. This one has three. It's helping your serotonin, your norepinephrine, and your acetylcholine. It's metabolized through your liver. The maximum dose that you should be taking of amitriptyline is 150 milligrams in 24 hours. If you're taking more than that, it's not working for you. Get off of it. And do not use this medication if you've had an MI, which is a heart attack. Please, it's just that bad. Here's the side effects of amitriptyline. Get this. It causes MIs, it causes strokes, it causes heart block, very low blood pressures, syncope. It can also do the opposite and cause very high blood pressures, fast heart rates, palpitations. It can cause you to go into a coma, have seizures, can cause hallucinations, delusions, confusion, incoordination, tremors, peripheral neuropathy numbness, tingling of the extremities, nightmares, dizziness, urinary retention, ileus, which an ileus is when you have a blockage in your intestines, and that can be life-threatening. It is life-threatening. Increased ocular pressure in your eyes, edema of the face, photosensitivity, altered liver function, a black tongue, testicular swelling for the guys, increased or decrease your libido, causes impotence, causes changes in blood sugar levels. So if you're diabetic, you got to be really careful with this medication. Weight gain. It causes a lupus-like syndrome. So some of you that might be getting rashes that you think are lupus, if you're on amitriptyline, you may just be having a reaction to this medication and not actually have lupus. It can cause your ANA to be positive and can cause rheumatoid factor to be positive on your labs, which means that you're having the lupus-like syndrome. You may not actually have the lupus. So get off this medication and then get your ANA rechecked in a couple of months and see if it goes back down to normal. It can cause blood clots. It can cause swelling in your arms and legs. So if you're on this medication and you're getting that swelling in your legs and arms and you don't know where it's coming from, it may be this drug. If you're pregnant, this is what it causes: delays of bone growth, of the incomplete cranial bones, the bone growth of the cranial bones. It causes central nervous system problems in the baby, limb deformities, and developmental delay. If taken with other antidepressants, it can cause seizures and death. So if you're taking amitriptyline and you're also on Cymbalta, or you're on Prozac or Effexor or any of those other depression medications, this with amitriptyline can cause seizures and death. So just be aware of that. Your choice. Meloxicam, off-label. This is an NSAID. The maximum dose is 15 milligrams a day. It's used for rheumatoid arthritis and osteoarthritis. NSAIDs are not going to help fibromyalgia. We do not have inflammation. Some of our symptoms may be caused from inflammation somewhere in our body, but fibromyalgia itself does not cause inflammation. So why are we even on this medication? I don't even know why they give this to us. So call 911 if you think you have any GI bleeding. And basically, you'll have black tarry stools, or you'll start bleeding from your nose, or your gums will start bleeding. That's how you know you have GI bleed. You can throw up like coffee ground. It looks like coffee grounds. When you get blood in your stomach, the acid in your stomach turns the blood to black little coffee ground. So when you throw that up, if you ever throw something up and it looks like black coffee grounds, that means you were bleeding in your stomach. So you need to go get that checked out. It can cause gastric ulcers. It can cause liver toxicity. These NSAIDs are just really bad for your gut, really hard on your body. It can cause high blood pressure, heart failure, and renal toxicity. It also causes skin rash, rapid weight gain, bloody stools like I talked about, and swelling of your ankles and feet. Do not take any NSAIDs if you're on blood thinners, if you're on SSRIs, which are all of the depression medications, ACE inhibitors, which is for your heart, like Lipitor, beta blockers, which is also for your heart, diuretics, lithium, or methotrexate. Do not take meloxicam with that. All right, next, trazodone. We have about 7 left, you guys, so we're almost done. Trazodone is also off-label medication. It's an antidepressant. Again, the maximum dose is 400 milligrams in 24 hours. Call 911 if you get a penis erection that is painful and lasts 6 hours or longer. I bet they didn't tell you that, guys. Fast pounding heartbeats, shortness of breath, pass out, very slow heart rates, bruising or bleeding, and then you can get low sodium from this medication. So how do you know if it's causing low sodium? You're going to have headaches, you're going to have confusion, you're going to have slurred speech, you're going to have severe weakness that you just can't get out of bed, so you're so weak. Severe dizziness, and very unsteady, and nausea and vomiting. I get a lot of little old ladies in the hospital with low sodium all the time because they don't drink enough water, and these are the issues that they have. So just be aware of that. Do not take if you're pregnant or breastfeeding, period. It didn't say what it causes, but you shouldn't be on it. And I think that was pretty much it with that one. The drug interactions with this one are other antidepressants, St. John's wort, tramadol, diuretics, anti-anxiety medications, blood thinners, and migraine meds. All right, next, Provigil or Modafinil. This is another off-label medication that they give us to treat our fatigue. Thinking if they give us a stimulant, that's all of a sudden going to wake us up, right? So here we are, you guys, taking drugs to sleep, taking drugs to stay awake, taking drugs to keep, our mood stable and all of this stuff. And how's that helping our fibromyalgia? It's not, because our fibromyalgia still comes through anyway. You can take this Provigil all you want, but you're still going to feel fatigue. It's not going to cure that for you. So, anyway, the maximum dose of Provigil is 150 to 250 milligrams in 24 hours. It promotes wakefulness. It's used to treat sleep apnea, narcolepsy, and chronic fatigue usually. Get this, you guys. It's not intended for long-term use at all. 12 weeks is the max that you should be on this drug at one time. This is what can happen if you have interactions with it. Call 911. If you get skin rash or hives, blisters or peeling, mouth sores, trouble swallowing, fever, shortness of breath, leg swelling, liver failure, or hallucinations. With this medication, they even made a point to put that any kind of rash is serious. So if you're taking Provigil and you get any kind of rash when you take that medication, call your doctor or go to the ER because it's serious. This drug can actually cause back pain as well, anxiety. It can cause you to have a stuffy nose, and it can make birth control pills less effective. Now, Naltrexone, a lot of you have been put on this lately. It's another off-label drug. This drug actually blocks the effects of opioids. It's used in alcohol treatment for people who are trying to not drink alcohol anymore. Makes them throw up if they drink alcohol. So the maximum dose of this one is 25 to 50 milligrams in 24 hours. So basically, it's because they're thinking that it blocks the effects of opioids, that maybe somehow it's going to block our pain signals in some way. I'm going to tell you guys, I've tried all of these medications, and most of them work for a little while, but then they stop working. And honestly, the side effects were more than I can deal with. So I just got off of everything. Call your doctor if you're on Naltrexone and you have severe nausea and vomiting, confusion, hallucinations, or liver problems. All right, Topamax or Topramate. It's another off-label drug. It was created for seizures and sometimes used for migraines. Call your MD if you have vision problems, eye pain, sudden vision loss, again, can become permanent with this medication, confusion, dehydration, kidney stones, irregular heartbeats, loss of appetite. It can cause numbness and tingling in the arms and legs, stuffy nose, sneezing, sore throat kind of stuff. It also makes birth control pills less effective. And if you're on this medication, it said avoid a keto diet when you're on this medication because of the damage it does to the kidneys. And keto diet is also hard on the kidneys, so you could put yourself into kidney failure. Protonix or pantoprazole. It's a proton pump inhibitor. It's used for esophagitis, GERD, or gastritis. This is what I take it for, is my severe gastritis. It works great. It's awesome. I've tried a lot of the other like Pepcid and Zantac and all that other over-the-counter stuff. Does not work as good as this. And those other over-the-counter proton pump inhibitors, by the way, do have a lot of lawsuits because they cause things like cancer and just don't work good. So I would go with the prescription if I were you. Call your doctor if you have severe stomach pain, if you have sudden pain in moving your hip, wrist, or back. Decreased urine output, if you have rapid weight gain. It can decrease your magnesium. It can cause dizziness, heartbeat, irregular heartbeat, tremors, muscle jerking or spasms, a choking feeling, new or worsening symptoms of lupus if you have lupus. But I do great on this. I don't have any of those issues at all. Okay, prednisone. Prednisone is not even indicated for fibromyalgia because, again, prednisone is to decrease, it's a strong drug to decrease massive inflammation, which we do not have with fibromyalgia. It's a corticosteroid, like I said, decreases inflammation. What it's usually used for is autoimmune disorders like colitis, arthritis, lupus, psoriasis, COPD, and asthma, because it helps decrease the inflammation with lung issues as well. It severely weakens your immune system, so be aware of that. You can also get what's called steroid-induced diabetes. If you're diabetic, you really have to watch your blood sugars on this. You may have to increase the amount of insulin or medications you're taking because prednisone causes high blood sugars. So just be aware of that. And also, because it causes high blood sugars in diabetics, it also causes high blood sugars in non-diabetics. So a lot of my patients in the hospital, when they come in with lung issues and we have to put them on high doses of prednisone, we have to check their blood sugars like they're a diabetic and treat them with insulin because you don't heal when your blood sugars are too high, and we have to keep their sugars controlled. And then once they go home, of course, we wean them off the insulin and whatnot, and their sugars go back to normal. But just be aware of that with prednisone. It causes many other long-term issues in your body as well. We always know when someone comes in and they're on long-term prednisone because we say how they have prednisone skin. That's how we say it when nurses are talking in report, because you just have bruising all over your skin and your skin's just really thin, and that's what prednisone does to you. It also causes swelling, so it causes rashes, itching, swelling, dizziness, muscle pain or cramps, fever, persistent sore throat. It can also cause GI stomach bleeding. It can slow your wound healing if you have wounds or anything. Like I said, thinning and bruising skin, bone pain. It can cause a change in your periods and can increase your thirst and urination. So just be aware of that. Do not take prednisone if you have cirrhosis of the liver, if you have kidney or heart disease, thyroid problems, diabetes, TB, malaria, or ulcers, because it can make all of this stuff worse. All right, almost done, just a couple more. Effexor is an antidepressant. Also, I'm going to include fluoxetine with this, which the other names for Effexor is venlafaxine, and fluoxetine is Prozac, okay? Antidepressants. Effexor is 37.5 milligrams twice a day. The max dose is 225 milligrams in 24 hours. Prozac, same thing, 20 to 60 milligrams a day. Max dose is 80 milligrams a day. Call 911 if you get skin rashes, hives, difficulty breathing, or again, swelling. These drugs can cause eye pain, seeing halos, easily bruising, seizures, rigid, stiff muscles, meaning that you cannot move them at all, high fever, sweating, tremors, can decrease your sex drive, cause impotence, can cause abnormal ejaculation, difficulty with orgasms. Do not take this drug with tramadol, with blood thinners, or other antidepressants, because of why we talked about earlier, the serotonin syndrome. All right, I'm going to talk about a couple of medications that I've seen you guys talk about, and I just want to give you the information about them. First one is ketamine. A lot of people are wanting to do ketamine infusions. This is an anesthesia drug. They use it to put you to sleep, mostly for burn patients and for animals. This is what they put horses down with if they need to sedate them with anything. It's very strong. They also use it in children and adults who have severe burns all over their body. They use it for their dressing changes and things, so that they don't have to deal with the pain during their dressing changes. So it's sedation. The only reason I can think they're giving it for fibromyalgia is because somehow maybe it just kind of numbs everything in your body for a little bit or whatever, but you really have to be careful because it can, you don't know, it can sedate you to a level that can be dangerous. And I know the doctors are in control of that, and they're not going to try not to give you too much, but you never know how you're going to react. Do not get ketamine infusions if you have hypertension. Just don't. And you know, I don't have too much to say about it. I've never tried a ketamine infusion. I think doctors are just getting desperate, basically, of ideas and things to try to treat us and get our pain less. But this is not a drug that I would ever suggest or use on anybody with fibromyalgia. Lidocaine infusions, however, is different because lidocaine, I've gotten lidocaine injections before when I've been in severe flare-ups, and I've only had this in Oregon because they don't do it here in California where I live. But lidocaine is used for peripheral nerve blocks. You know, it's a numbing medication, and we also use it in emergency cardiac situations because it decreases your heart rate and mellows out those terrible rhythms that you get in your heart. So they have to be careful cardiac-wise if they give this to people. But what it did for me is it really, because it's a numbing agent, it kind of made my whole body feel numb from head to toe. And I'm not talking the numb, like the numbness and tingling you get. It was just kind of like when you're pouring that thick gel over yourself when you have like a sunburn and you're just looking for that soothing effect of, you know, cooling off. That's kind of what the lidocaine drip did for me. And I only did it when I was in flare-ups, and it stopped a flare-up, and it usually lasted for about a week. It was awesome. I wish they would do those more because that actually I have found really helps. But like I said, you have to be careful because it can cause lightheadedness because it can, you know, lower your heart rate or your blood pressure. But otherwise, there's really not any reason to not try that. The only risks of spinal blocks, though, if you get it for a spinal block, is you can have loss of bladder and bowel control and severe sexual dysfunction just because of the nerves in the area of where they're trying to do the block. So just be careful with that, but it's something you might want to ask your doctor about. Maybe we can get him to start doing that again because I found it really was helpful. All right, now we're going to talk about kratom. Kratom comes up a lot. And I went to the FDA website so that I could get the current information on what they're doing with the research with this, because there is no research on it, and it can be life-threatening. So let me just tell you what the FDA's website says, and you can decide, like I said, any of these medications, it's up to you. You can decide for yourself at any time what you want to put into your body. I'm just trying to give you the information that's out there so you're aware of what you might be getting yourself into, because kratom is not regulated at all. So you just have to be really careful. So what is kratom? Kratom comes from an evergreen tree and it's in the coffee family, and it's in, I think, Southern Asia, or Southeast Asia, somewhere. So this is what I know about it. It's known that a dose of 8 grams or more is dangerous. They know that. However, they do not know in anybody's individual body what dose is going to be critical for you. They say that up to 8 grams is okay, but that may not be okay for you. And they have no research or anything to back that up with, okay? They have no evidence of what dose will be toxic to any individual. So in my opinion, every time you take it, and you're putting your life at risk. Some will say that's pretty extreme, but why is this drug banned and illegal in so many areas if it's not serious? So they say it acts as a painkiller and a sedative, but the results of these benefits have not been studied in any clinical trials ever. It has serious potential for abuse, addiction, withdrawal, and death. The U.S. FDA is considering banning it in the U.S. It can cause seizures, decreased respiratory function, coma, hallucinations, and death. They have no idea how it works in the brain yet. There have been 1,800 calls to poison control in the United States between 2011 and 2017, including reports of death. Other side effects it can cause: high blood pressure, weight loss, dry mouth, chills, nausea, vomiting, liver damage, and drowsiness. So just be aware of your liver function if you're going to take this medication. In animals, kratom is even more potent than morphine, they discovered. So it's very strong. Be careful. There's no evidence that kratom is safe or effective to treat any medical conditions, is what it said on their site. One of the problems with kratom is it's a mixture of many different compounds, different chemical compounds, and the levels can vary from prep to prep. So depending on, I mean, even in the same company, whoever prepared it for that bag, the amount of chemicals that's in the next bag can be different. So you don't even know if you're getting a toxic dose or not, because there's nobody regulating it. They don't test it in the lab. They have no idea how much they have put in when they've done their mixing and that kind of stuff. So just be aware. Half of all kratom products are testing positive for salmonella. So be aware of that as well. You don't know which companies, you don't know which bag you're going to open that's going to be have salmonella in it. And if you have autoimmune diseases or you're taking a medication that lowers your immune system, this is going to be devastating for you. Are you willing to take that risk? So here's places it's already illegal. It's illegal in Denmark, Finland, Ireland, Latvia, Lithuania, Poland, Romania, and Sweden. In the U.S., it's illegal in Arkansas, Alabama, Indiana, Rhode Island, Wisconsin, Vermont, and District of Columbia. Cities where this drug is banned: Alton, Illinois, Columbus, Missouri, Denver, Colorado, Jerseyville, Illinois, San Diego, California. I didn't even know that, believe it or not, because that's where I live. And Sarasota, Florida. And there are other states and cities in the process of banning that drug as well. So just check wherever you live and just make sure it's okay. Side effects that were studied in a hospital setting of people who took it. Now, this is not any kind of research or clinical trial. These are people that came in the hospital ODing on this medication, and these are the side effects that they observed on these people. They had a decreased LOC, which is a decreased level of consciousness. So you become unresponsive, where you're just like not even responding to anybody or aware what's going on. Severe agitation. It depresses your central nervous system. It can cause seizures, tachycardia, which is fast heart rate. It can cause severe drowsiness, hypertension, confusion, renal failure, and coma. It also causes liver toxicity, and it will shut your kidneys down. So, like I said, take it at your own risk. This thing, they don't know much about it, and it seems like, I mean, honestly, I would not risk my life with it. Again, it is not known what dose is safe for people. There have been 152 cases of overdose deaths from 11 states between July of 2016 and June of 2017, and 27 more reported from June of 2017 to December of 2017. So that's almost 200 deaths from overdose in 1 year of people that were using this drug. So bottom line, like I said, use at your own risk. Now let's do Botox really quick. A lot of doctors are starting to say, hey, let's do Botox injections all over your body, wherever it hurts, because this works for migraines, right? Botox is a botulinum toxin. I don't know if all of you guys realize that. It causes botulism, which is the disease you get from canned foods if they've been in canned foods too long, something, with the metal or whatever. It's very serious, and personally, I would never put that in my body on purpose. I can't hardly even understand their thinking. They have done no clinical trials on this. They have no clue if this is going to work for fibromyalgia or not. And honestly, you can't put Botox in yourself all over your body. And I'll tell you why in just a second. So emergency side effects from Botox: hives, itching, wheezing, difficulty breathing, and swelling. Botulinum can spread to other body areas beyond where it was injected, and it can cause death. So they can inject it somewhere in your body, even in your sub-Q tissue, but it can travel from that sub-Q tissue. It can get into your bloodstream, it can get into your muscles, it can get into a lot of different places it's not supposed to be. And what botulinum is it's a neurotoxin. So it causes you to become paralyzed, and in that process stops your lungs and your heart, so you can't breathe and you die. So, it's your choice. You can take those little shots that doctors say are safe, but just be aware it can travel anywhere in your body. And that one time you get it in your bloodstream, sorry. So side effects that can happen within hours to weeks after an injection. You can have severe muscle weakness, especially in an area that was not injected. You can have trouble breathing, talking, or swallowing. You can have loss of your bladder control. You can have a hoarse voice. You can have drooping eyelids, eye pain, chest pain, irregular heartbeats, burning, or painful urination. So, if you think that botulinum is in your blood or it has reached your nervous system, here's what you need to watch out for, or get to the ER as fast as you can. It's a toxin that attacks the nerves. Like I said, neurotoxin. It starts with weakness of the muscles that control the eyes and the face and the mouth and the throat. So if you're finding it hard to open your eyes, like droopy eyes, if your face has become numb, or you cannot smile because your nerves are not working, or you can't swallow right, whatever, that's very serious. It can spread to your neck, your arms, your torso, and your legs next. And like I said, it's paralysis of the muscles and of your body, and eventually stops your breathing. So one last thing I want to mention, there are a lot of medications, like I said, to increase the neurotransmitters. So I told you I was going to go over the neurotransmitters a little bit. So our fibro bodies are low in serotonin, norepinephrine, and dopamine, and we have high substance P and glutamate. So remember, those are chemical messengers that help our brain talk to our body. Many of our malfunctions are a result of the neurochemical imbalance in the CNS, which is why they think if they increase some of these neurotoxins or neurotransmitters, that it's going to help our fibromyalgia pain. But that fibromyalgia is so complicated, and this is not the only mechanism that's causing our issues. So what do they do? Excuse me. Serotonin is present in the brain. It also is made in our bowels and in our platelets, and it regulates body temperature. Wow, that could be our issue with body temperature. But the serotonin that's made in the bowels and in the platelets cannot get to the brain, which is why the brain makes its own serotonin, which is why we have to take medications to increase it. So what does it do? What does serotonin do besides that? It's a mood. It helps our mood and our emotions. It helps our appetite and our digestion, and it regulates our sleep and wake cycles. So that can help, with our sleeping as well. Serotonin does not cross the blood-brain barrier, like I said, so the brain has to produce its own. It's used to treat depression, PTSD, panic attacks, and helps us sleep. Norepinephrine, it's important for attentiveness, staying alert, emotions, sleeping, dreaming, and learning. So our norepinephrine is low, but here's what it helps with. It keeps our blood sugar levels up. It keeps our heart rate level up. It increases the contractility of our heart and blood vessels, which means it gives them that extra power that they need to pump so that they can get the blood around where it needs to go. And it increases our blood pressure, which also does the same thing. So low levels can cause anxiety, depression, can cause hypoglycemia. So if, I've had hypoglycemia, actually when I was pregnant. I didn't get gestational diabetes. I had hypoglycemia problems, and I was like, different certain times in my life, I've had low blood sugars, and I never could figure out why, and now I know why. Low levels also can cause migraines, can cause restless leg syndrome, and sleep disorders. So this is why those depression medications are good for us, because they're going to help, fix some of these things. High levels of norepinephrine, on the other hand, if you think your levels are getting too high, it can increase your blood pressure, increase your anxiety, cause excessive sweating, heart palpitations. It can also cause tumors to form on the adrenal glands, which is not good. Dopamine. Dopamine helps us feel good, helps us think, helps us plan and focus. So it helps with our learning, our blood vessel function, our kidney function, lactation. It helps sleep, attention, and mood. It controls nausea and vomiting. It helps with our pain processing. It's actually the main pain processing neurotransmitter. So that's the one they're trying to hit all the time with these medications, because hoping that it's going to decrease our pain. It helps with our body's movement. It helps with our motivation, our internal motivation, and heart rate control. Substance P, which I said is high in our bodies, its role is pain perception. So no wonder it's high, right? We are very sensitive to pain perception. It also helps your emotional behavior, stress, inflammation, smooth muscle contraction, saliva production, blood cell formation, wound healing, and allergies. So you see, everything that happens in our body is controlled by our brain and our neurotransmitters. So why would your substance P levels be high? Well, they can be high from inflammation, stress, or pain. So our levels are typically high from pain. So if your doctor ever says, oh yeah, your substance P levels are high, that's why. It doesn't mean you have inflammation. It's your pain processing. It works on the memory center in the brain associated with learning and formation of memories. So if you're having trouble, forming memories, it could be from the substance P. And it can help stimulate nerve cell formation after an injury. It causes, oh boy, this may be our answer for all of our itching that we get all over our body, you guys. Substance P causes itching by stimulating the histamine response. It causes eczema, and it also causes Raynaud's. So some of us might be getting the Raynaud's because of our substance P levels. And the itching, we all know how that drives us crazy. It stimulates the histamine response. So using antihistamines or something like that, but make sure that doesn't interact with any of your other medications that you're taking. But really what it said is that massage therapy is the best way to lower your substance P. So if you want to help your itching, get some massage therapy, because when they work on your body with massage, they release a lot of toxins and those extra things from your muscles, and you flush them out of your body. And so this is how massage can maybe help us in some way. Glutamate, which I said is also high in our brains. This is the main excitatory neuron in the brain. It's in the brain and the vertebrae nervous system. It plays a big role in developing brain levels that should be tightly controlled. Controlled. Nerve cells use glutamate to send signals to other cells in the central nervous system. So it being the main excitatory neuron, which is, we're over our nervous system is overactive, could be from the glutamate, because our glutamate levels are typically high. So we need to lower those a little bit. They didn't really give any good information on how to do that, but the glutamate can lead to nerve cell death and also ALS and GAD. So just be aware of that. And the last one is GABA. Its natural function is to reduce the activity of the neurons, calming the nervous activity in the brain. This one, I think, probably would help us the most. Our GABA levels seem to be high usually. So it should have a calming effect on our brain. But maybe our levels are low. Yeah. I can't remember on that one, sorry. Anyway, so the ion channels in the central nervous system and the peripheral nervous system that support your neuromessages moving through the myelin sheath. So the GABA is a big precursor to getting MS because it's actually in the myelin sheath is where that one lives. So low levels can cause seizures, Parkinson's, and anxiety. High levels, our levels must be high. Hyperinsomnia and daytime sleeping. You can have low levels caused by chronic stress and not enough exercise. They're doing more research on GABA to see if it will decrease the development of autoimmune diagnoses. So this is a big one that they're looking at right now. I recently just started taking some GABA supplements to just see if it helped clear some of that brain fog and kind of calm things down a little bit. I really haven't, I've been taking it for a few weeks already, but I really haven't noticed any difference yet, so I'll keep you posted on that. And here is the last thing I want to give you. You can get a neurotransmitter test. It's actually a urine test, and it's a send-out test, so your lab has to send it out to get it done. I'm surprised they don't test us more often, especially putting us on medications that increase the levels of these in our body all the time. But ask your doctor if they will do a neurotransmitter test and just kind of see where you are with your neurotransmitters. Because then they can give us the drugs that would be more effective for which neurotransmitter is out of whack. Because, maybe one's out of whack, but the other ones aren't. And, it's just more information. So it's better to have than not to have. Okay, so that's it for medications. I hope that was an eye-opener for you guys. I hope you got more information about the things that you're taking. I don't know about you, but I'm really tired of being a guinea pig to these doctors. These doctors are really, really making me angry more and more as the years go on because basically they're just done with us. Rheumatologists don't want to treat us anymore. They tell us to go back to our primary doctor. Neurologists, they can kind of help us, do some nerve tests and things, but they don't really want to follow fibromyalgia. So who's going to take care of us? And when we go into their office, they roll their eyes or they dismiss whatever we're saying to them, or they say it's because we need to change our diet or lose weight, or they just throw another prescription at us. Well, you keep saying none of these drugs work, so I'm just not going to give you anything anymore. And how is that helpful? So, yes, it's really irritating. This disease is really hard for us to get the things that we need. And this is the reason I'm doing these videos, because everybody needs to know what's really going on, and the doctors aren't telling us anything. And these medications are harmful at best. They're not doing any good for anybody. And I just want to tell you my experience really quick, being off of all these medications. Like I said, the only thing I'm on at prescription is the Flexeril and my hormones, because I had a total hysterectomy, so I control my hormones that way. And the effects are for my depression, but everything else I treat my fibromyalgia with is all supplements, and I get along just great. And let me tell you how many symptoms of my fibromyalgia were way worse when I was on the medications. You just don't realize it. You start taking these medications and you think they're helping you, but trust me, once you get off of them, that's when you're going to see, oh wow, yeah, it was causing a lot more problems and it really wasn't helping my pain, and it was just masking other things and making things worse. So that's my personal experience and opinion about these medications. So you can come up with your own and make the decision for yourself. But I hope this was helpful. If I didn't cover any medications that you have questions or issues about, just drop some comments and let me know what you're thinking. And I guess that's it for today. So have a great day. Bye till next time.